I am Dr. Shravan Kumar. I am a professor of gastroenterology, Gandhi Hospital. Here with today we have been now this is the NASH week. So for this, what is NASH? NASH means non-alcoholic steatohepatitis. So this is the problem with many of the people nowadays. So they are being having diagnosed with liver disease. This liver disease happen to be other than the alcoholics. So non-alcoholics also they are getting liver disease. So if you see the causes for non-alcoholics are getting liver diseases, certain things like viral diseases, hepatitis B and hepatitis C, there are two important viral diseases causing the liver disease. In addition to that, nowadays the NASH is becoming more and more commonest. So some fatty infiltration, NAFLD, non-alcoholic fatty infiltration, that means the fat is getting accumulated, enormous fat is getting accumulated in the liver. In addition to that, some of them, they are going to become NASH. So that liver inflammation, whatever is fat is getting accumulated, that is becoming more and more, that is giving rise to inflammation of the liver disease. So because of this inflammation, constant inflammation resulting to chronic liver disease like cirrhosis of the liver. So now this is becoming a worldmost is a burden, highest burden of the liver diseases now is coming back to the NASH. Earlier days people used to die with alcohol. Now the people, those who do not take alcohol also, they are having this kind of NASH as well as the cirrhosis of the liver. If you see the main etiologies of the NASH, that is being the obesity, high BMI, it's a metabolic syndrome. So in the metabolic syndrome comes to the diabetes and the obesity and high glycemic, because of the glycemic index, high glycemic index and glucose tolerance, the increased glucose tolerance. So that is the reason people are becoming day by day because of the sluggishness of the metabolism. They are not going for walking, not doing any exercises, not taking care of proper diet. So they must be taking care of diet also very, very important. Less oily foods, basically saturated fatty acids, they should not consume. Because of the saturated fatty acids predominantly that is there in animals. So animal fat, especially excluding the fish is good, but chicken and mutton, all those things having the saturated fatty acids. So these kind of fats should be reduced. Lot of fried foods, food fries and the oil based foods like biryani, bagara, fried rice, all those things they must consumption should be less. And as well as the exercise, regular exercise, 1 hour exercise is very, very important, like walking or dynamic exercise rather than the isometric exercise, the isodynamic exercise. Isodynamic exercise like swimming, walking, all those things will cause, there is a reduction of the BMI. So people should reduce the basal metabolic index, that has to be reduced. As soon as they reduce the BMI, the fatty liver infiltration of the liver and NASH will automatically, it will come down. So the lifestyle modifications. So basically the lifestyle modification, people should have the good sleep, good dietary habits, and they should have the food items should be more non-oily, non-greasy foods. Sweets must be reduced. Carbohydrate must be very much reduced. Fructose taking also they must reduce very much. Basically cool drinks, they must avoid all cool drinks. So Coca-Cola, Thumbs Up, people are very much addicted to take lot of cool drinks. So these cool drinks must be very much reduced. And fructoses, more fructose are than fruit juices. People are also very much fond of taking fruit juices. So these fruit juices also, they must reduce the fruit juice intake because the fructose is also a predominant factor for getting NASH. So overall thing is that lifestyle modifications, and they have to see that their weight consciousness. People should be very much weight consciousness. So that of course the medications are there in the market, but unless until they do the lifestyle modifications properly, these medications would not be helpful very much. So the diabetes patients also very much fond of, they are getting the NASH. The reason is that improper diabetic the status, like the HbA1c must be very much less than 7 or 6.5. So they must reduce the HbA1c levels to lowest level, see that the blood sugar levels properly maintained, and the good exercise required. Sugary contents must be reduced, carbohydrates must be reduced, and proteins must be increased, and saturated fatty acids must be reduced, and proper doctor care and frequent fibroscan, that will tell you how much of CAP score, how much of fat infiltration, how much of liver damage, that is KPA levels, fibroscore levels, that will tell you the fibrosis of the liver. All put together, people should be very much intelligent enough to have a regular follow-up of the doctor, hepatologist or gastroenterologist, see that their fibroscores and fatty scores and whatever the CAP scores must be properly balanced. That would be helpful to everybody in the NASH patients. Thank you.